No, inasema pregnancy. Obstetrics ni during pregnancy.
During pregnancy and during delivery.
Kumbuka preconception ni gyna.
Oh yeah.
So
and we don't do so much on gyna.
So during pregnancy, during delivery and after delivery. Tumemaliza na tumepeana what are some of the obstetric issues we face, especially during pregnancy. Useme pregnancy, mimi niseme during labor, vitu kama bleeding, vitu kama and then after useme kama lack of milk, useme hivyo and pain, and then after that utaongelelea kuhusu importance of a midwife. So antenatally and then importance of a midwife, wacha tuweke during childbirth.
Both ni midwife sinikuguza tu.
Importance of a midwife antenatally during childbirth and after. And then mimi tuongelee vitu kama unajua ukisema importance umeongea kuhusu roles. And then sasa tuseme vitu kama tuna challenges and then we finish. Sini sawa budget?
Welcome to midwiferealityshow.ke.
My name is Evelyn.
I'm Mary. We'll be talking more on midwife issues on this channel. Kindly, Evelyn, welcome to the channel and introduce who is a midwife.
A midwife is a trained health provider who takes care of a woman during pregnancy, during labor, during childbirth, and after delivery. I hope I've done it well, Mary.
Yeah, it's somebody who helps women during childbirth, pregnancy, and after the baby is born. In simple terms, is some trained personnel who nurtures women during their childbirth age.
What are some of the issues that we face or a woman faces during pregnancy and that they're supposed to be maybe handled by a midwife?
Just before the baby is born, we can have several complications. Like we can talk of the major complications like bleeding. We talk of headache that can translate probably to high BPs or high blood pressure. We can also talk of reduced fetal movement, and all these are monitored by the midwife and educates the mother on how to take.
So Mary, maybe you can tell our people some of the issues that are faced by a pregnant woman during pregnancy.
The first thing we want, when a woman is pregnant, the whole journey we divided into 3 portions. We have the first trimester, which are the first 3 months. Second trimester, it's the 3 months to 6 months, and then the third trimester. Every trimester, a woman gets different changes in their body. The first trimester, that is between from the time of conception to 3 months, we expect the woman to miss her menstrual period. Very true. The second thing, they get tingling of the nipples, and they get laziness. Like sometimes you just feel lazy. Some even go to the hospital to be seen, like they are having malaria. They say they are having general body weakness, just to discover that they are pregnant. It's psychologically, women in that trimester keep thinking about, is my baby getting well formed? Or so their worry is the baby developing well? Then there are those mothers who vomit a lot in the morning, which we call hyperemesis gravidarum. I think Evelyn can also take us in second trimester, the changes that occur in second trimester.
Thank you. So in the second trimester, as Mary has said, it starts from the 4th month. It takes 3 months, from the 4th to the 6th month. It is the 4th, 5th, and the 6th month. Some of the changes that may take place, you find that the vomiting reduces, because the first trimester is the one which has a lot of vomiting, and there's a lot of body changes like adding of weight, and some of the pregnant women, especially those who are pregnant for the first time, tend to not like their bodies, which is normal. Adding of the body weight is very normal in pregnancy, and some hormonal changes occur. You may find that they are getting like facial changes, and most of them can continue until the 3rd trimester. So the belly will also grow until you can notice it by checking or by looking. Then there is the development of the line in between the abdomen, from the pubic area to the abdomen on top. Cut.
Is that?
What I mean is the line you'll see some darkening of the central part of the abdomen all the way to the pubic area, and that is a sign of pregnancy, and a sign that the abdomen is growing, and a sign that our fetus is growing. Maybe Mary, you can take us through some of the changes that occur during the 3rd trimester.
In the 3rd trimester, I'll first touch on the psychological aspect. This the baby is already well formed, has all the parts of the body are well developed apart from the lungs. All the hands, the legs, the body, it's a small human being that is growing. Now in this trimester, the baby is just going to gain weight. The mother's belly becomes bigger, and like from the 1st trimester, once you press the breast can remove some milk. That the linea nigra, or the line between the navel, now darkens further. The woman becomes, the nose becomes wider, and most women really dislike this stage because they get also bigger stretch marks, because now the belly is bigger than even before. Now you can no longer hide. This is why in African setting we say imepita guo. So the other thing, in psychologically, the mother now, her thoughts start thinking, how will I deliver this baby? The thought of that mother thinking, how will I even breastfeed this baby? Now those are the many psychological and physical changes that take place.
So what time does a mother know that my baby or the baby is ready for delivery? Does it mean when you reach the 3rd trimester, the 9th month, you expect labor to come or the pain to come automatically? Or what do we expect for a father? I'm talking this or that because some of our viewers may be first-time mothers who don't even know when to tell their baby is fully grown.
Yeah. Scientifically, we normally say from 37 weeks, the baby is mature. But we try to push until 38 to 42 weeks, because you can deliver your baby before with 2 weeks or by 2 weeks. Such that if you want to know that you are in labor, you start getting lower abdominal pains that relate to birth. You also get to see blood show as a discharge, not pure red, but it's mucus pinkish mixed with kind of blood. And then you also get, the day before or 2 days before, you get excess energy. You feel like washing, preparing. You have extra energy than any other day. Then you have that frequency in passing urine. Those are early signs of labor. And some also get running stomach. So, but the actual signs that you're going into labor, it's the low abdominal pain, radiating to back, show, and sometimes water can break,
Mm-hmm.
and the water can break from anywhere. It comes like urine, and the way you can differentiate between the baby's water and the urine is that you can't hold for the water,
Yeah.
but for the urine you are
can
able to
yeah.
hold.
Mm-hmm.
So it just comes anywhere, and then now if the water breaks, you need to go to the hospital.
And it's not necessarily that the water will break when you are in labor. It can break even before labor.
Yes.
Mm-hmm.
So you need to go to any medical facility near you and get checked.
Yeah. So, do you think during the childbirth, a midwife is important?
Oh yeah,
Mm-hmm.
a midwife is very important, because they are the ones. We are the ones who work with these mothers.
Mm-hmm.
You educate them
Mm-hmm.
on the signs of labor, danger signs. You nurture them. Like, I would say you are like their mothers.
Yeah.
Yeah.
You are there
And
for them.
you are there for them.
Yeah.
And that is why, like, when we were young,
Mm-hmm.
we used to think a midwife must be an old person.
Yeah.
That is when we were
young.
We were young before we trained.
Mm-hmm.
Yes.
And elderly.
An elderly person.
Mm-hmm.
But now,
anybody, any age.
Do we mind about the gender?
We don't mind about the gender because you'll find some of our midwives are even male.
Yeah.
Even